Hello there. Hi, my name is Julia Perkins. I'm one of the nurse midwives from Midwifery Care Associates, and I'm hanging out in my backyard, and I thought I'd put together a video for you. So you're preparing for your first visit. It's very exciting. You have lots of questions. What kind of provider do I want? Should I take a childbirth education class? What class? Should I be exercising? What kind of exercise? What kind of tests should I have done in this pregnancy? And that's the question that I want to explore today. As midwives, we believe in shared decision making and informed decision making. And as such, I want to put together a video to just start you down the pathway to asking the right kinds of questions and arriving at the answer that's right for you. So particularly I want to look at tests that screen and diagnose chromosomal abnormalities like Down syndrome. There are 2 screening tests and 2 diagnostic tests that are most common. And I like to explain the difference between a screening test and a diagnostic test. Screening test tells you your risk ratio, almost like a percentage. And some women already start out with a certain chance of having a chromosomal abnormality with their pregnancy just based on their age. So if you're under 30, it's somewhere around 1 in 1,000. Whereas if you're over 35, it's more like 1 in 400. Then there are these tests that look at a couple of different factors in your pregnancy and can adjust those kinds of risks. So traditionally, we used something called the first trimester screen. And that was both a sonogram that looked at the back of the baby's neck and a blood test. Now, there's another option that looks at cell-free DNA in the mother's bloodstream. And it's actually the baby's DNA. And both of these tests are very good. The new test also has the option of telling you what your baby's gender is after 10 weeks. However, it's not always covered by insurance because it's very new. So if you're interested in that test, I always encourage you to check with your insurance provider. Now, if you have these tests done and it looks like maybe there is an increased risk for Down syndrome or another chromosomal abnormality, your provider might recommend a diagnostic test. And as I said, there's 2. There's something called a chorionic villi sampling, and that test takes a little portion of the placenta to assess the chromosomes. And then there's also an amniocentesis that takes a little bit of the amniotic fluid. We don't recommend these as the very first option because they're invasive and some pregnancies would end in miscarriage. While that's very few, it still exists. With all of these tests, I recommend you consider what you would do with a positive answer versus a negative answer. So if you're at high risk, would that help you decide whether to do the amnio or the CVS? Would it help you prepare for maybe a special needs child or change the course of your pregnancy? Or would it just increase your anxiety? So these are the questions to ask, and while we will do our utmost to give you all of the answers for your questions, these are decisions that you have to make in consultation with your provider as well as your family. So I think it makes sense to think about it and do the research. And I plan to put some links here so that you can read a little bit more about these tests and come in prepared to make a decision as to whether you want to do those tests, because they're best if they are done early on in the pregnancy regardless. While the cell-free DNA screening test can be really done at any time during the pregnancy after 10 weeks, the first trimester screen is very much time dependent and ideally done around 12 weeks. So those are things to think on, and we encourage you, as I said, to come in with a wealth of questions and curiosity. Look forward to meeting you.